women ministers in Bangladesh. The entire ministerial team, 90%, what they say is finance. The woman is the head of the family. 90% of the times, she will spend that money on children's education, khana pina, taxation laga ke nahi. She'll take care of her parents and her in-laws and take care of the husband also. Not that men don't do, men also do it. But the chances that if the man is not so good, he will spend away on non-specific things, smoking, alcohol. They will spend for children's education, but that doesn't become a priority. So everybody's now woken up to the fact, if the sky is held 50% by women, why not give them importance everywhere? Because they are multitaskers. They can take a lot of decisions and they will remove gender disparity which is existing. With men, they will still choose to use men. I just want to give you a quick example. 3 years back, just before COVID, the Prime Minister Narendra Modi had invited an entire film delegation to meet to see how they can make better films for social upliftment of everybody. And that entire delegation did not have one single woman. So even before the meeting started, Narendra Modi said, "क्यों भाई? आपकी फिल्मों में ladies नहीं रहती? फिल्मों में heroines भी तो रहती हैं. फिर आप 20 लोग आ गए, एक भी उसमें women representative नहीं है." And one of the very prominent persons, Karan Johar, was there. There was another, Raju Hirani was there. All these are all prominent people. They apologized and they rescheduled the meeting. Because that was not right. When you are talking about representation, you must have your women and men together. There may be a disproportion, but you have to have inclusion. That is very important. Now, why does gender matter to nutrition? I've already said that malnutrition reflects socio-economic and gender inequalities, particularly for access to food, income, productive resources, essential goods and services. And most of the women, particularly the younger age girls, then they're going into motherhood, then they're going into everybody has specific nutrition needs. And these need to be acknowledged. ये नहीं कि I have got 2 kids, my kids are in college, मैं कुछ भी बच्चा कुचा खा सकती हूँ. We don't want that. We don't want a pregnant woman who's got in-laws in the house. She's feeding the in-laws, she's feeding the older kid, she's feeding the husband. फिर आधी रोटी बचती है, थोड़ा सा सब्जी बचता है. She'll say, नहीं बस मेरे लिए यही काफी है. No, it is not. There is a gender requirement here, a gender, sensitivity in the entire family to say, पहले the pregnant lady will eat and then the others will eat. So empowering women. Empowerment means what? Basically, you are allowing the women enough power to take her decisions on her own. And for that we have to create that microenvironment. So you feel strong enough mentally, physically, spiritually to take that independent decision without coercion, without anybody forcing you to take it. That is called as empowerment. And truly empowered nation will be when women, each and every woman says, I can take my own decision when I want to get married, how many children I want to have, what contraception I should use, whether I should work or not, whether I should just be sitting at home. It is a choice. There are educated women sitting at home, but that's a choice they've made. So nobody should force them to do what they have to do. Friendly talks, discussion, that's fine. But आप घर में बैठिए, मैं कमा रहा हूँ, आपको क्या ज़रूरत है काम करने की? That should not be the thing, correct? So therefore, that is what is empowerment. So the woman then resources, opportunities, services. They can utilize the information for productivity, for better health and nutrition. Good nutrition is necessary, not just for capacity to contribute to society, but also because it affects women's health. If I'm healthy, look after my kids better. If I am going to suffer all the time, कुछ फायदा नहीं है. मैं Jesus Christ नहीं बनना चाहती. I want to be myself, I want to be an empowered woman, so I can take better care of my family. So there is an increasing concern about possibility that if there is maternal malnutrition, it may contribute, अभी नहीं, आगे जाके, अनीमिया तो एक बड़ा प्रॉब्लम है, but अनीमिया के साथ साथ cardiovascular, and if your immunity is reduced, then non-communicable diseases. So this is something very, very important that we have to look into. So what are the lifestyle changes that you recommend the young people? Right from the start, you change करो ना. Why are the mothers pampering the kids and saying, तेरे को 30 दे रहे हो, तू जाके बर्गर खा ले. So the kid says, no, no, mom, I will not take home dabba at all. You insist the kid should take the home dabba. Even if they're going at 7 o'clock in the morning, they can have a glass of milk and go. Attend your colleges, and instead of eating only masala dosa or burger at the corner, once in a while that is fun, but not on an everyday basis. So dietary modifications, no starving. We don't want a zero figure like Karina and crash diet. Eat sensibly. If somebody, particularly the young people, are on the heavier side, a lot of obesity is prevalent in the young crowd. So take professional help for weight loss or weight gain. Timely eating, inclusion of sabzi roti, but all different vegetables, all the different fruits that are available, whatever is affordable to the pocket, it is possible. Please do it. And encourage a balanced diet. Many of the communities, they eat late at night. Husband late आता है तो मैं भी रुकती हूँ, मैं रुकती हूँ तो बच्चे भी रुकते हैं. So everybody eats at 11:30, goes to bed at 12 when the kid has to go to school at 7. No, the kids and the mother and the older people must finish their food by 8:39. Jain principle is good 7 o'clock, but 7 o'clock possible नहीं होता. तो कम से कम 8:30-9 तक क्यों? Because then till you get to bed, you walked around, you've given some metabolism. Otherwise, what happens is, as you're growing older, obesity, fatty liver, ये problems आ जाते हैं. And physical activity is very important for everybody. A to Z. आपको भी, आपके husband भी, मेरे सब members हैं, everybody needs physical activity. बेटा पानी ला के दे, बेटा जरा light लगा के दे. No, you get up and do it yourself. And any problem, please regular follow-up for your diet issues. And today, I think many of the people have started realizing physical fitness is very important. Now you all have kids in the house. Kids are keen observers of what the mother, the role model in the house is doing. सास से कैसी behave करती है. Husband and wife की quarrel should not be in front of the kids. They're keen observers. They will exactly want to do whatever. You may not get along with your husband. Discuss it in another room, not in front of the kids. Parents' attitudes towards the neighbors, towards the in-laws matters, because that's where the kids' impressions are formed. Children, little children, they are so observant. When a dadi walks with her hands back, that little child, just 4 years old, also is walking with the hands kept back and walking. So children are observers. So spend quality time with the family and take a holiday in between. Whatever, you don't have to go to Hong Kong, you don't have to go to Maldives. नज़दीक कहीं पे भी जा सकते हो, but take a break. So that is very important, and teach children the value of money. Mobile चाहिए, mom, no. You can't get a mobile till you're in this particular class. You can't just while away money. You have pocket money, you learn to spend it over a month. Don't only one child. Most of the working mothers feel guilty and they say, चल बेटा ये ले ले, तेरे को ड्रेस चाहिए, चल ये ले ले. Don't do that, because you are spoiling, you're pampering your child. Teach them to be brave, teach them to be courageous, and teach them to learn to value time, money, and women and elders. Okay? Particularly boys. We must teach our boys, respect all women in the society. You fight with your sister, you have quarrels with her, all that is okay. Masti maja, but nothing beyond that. And parental guidance is very important, particularly when there are malnutrition issues. Phone, I want to just show you, I don't have a phone just now in my hand. The continuous phone, just give me your phone. The kids are on the phone all the time, walking on the phone. यही सब चालू रहता है. You get out of office, ting tong, कान में आ जाता है. And what does it matter if you don't know what that message is? Train से लटक रहे, इधर से पकड़ा है और इधर से phone पे चालू है. So I think we are abusing the phone. Phone should be used where necessary. आज दाल कौन सी बनाई, दाल दाल में कितना नमक डाला. You don't have to ask. Take your time to talk to people, but phone पे time कम spend करो. Walking on the road, crossing the road पे भी रहता है. And cyberspace, kids are hooked onto the net, particularly adolescents. Watch what their porn spaces are easily available. Please make sure that your children are dekh rekh kare. Don't be Inspector Eagle, but at the same time see what the kids are doing. Give them that time. Show them you care. Give them that holiday. It's family space, very important. And make them exercise, make them sleep in time. और पानी, little girls going to school 7 बजे जाते हैं. मैं एक गिलास दूध पीती हूँ, फिर स्कूल में जाके मैं वॉशरूम जाने को टाइम नहीं रहता. बटन में स्कूल गेट होगा 3 o'clock. Then there is a big queue in the washroom. So फिर मैं घर आती हूँ तभी 7 o'clock to 3 o'clock, no going to washroom. So no drinking water. So it's a vicious circle. Drink water, and all of you tell, as parents, tell the teachers, keep more bathrooms, keep them clean. We have to emphasize toilet is a right, not just for a woman, for everybody. Clean toilets particularly. And very, very important is, I've already mentioned this, be there for them emotionally and physically. What are the problems that are faced by a teenage girl? Not getting periods at the right time, having too frequent periods. By the age of 16, if the girl has not got her periods, she must see a gynecologist. By the age of 14, if there is no development of secondary sexual characteristics, the breast development, the hair, the pubic hair, the axillary is the armpit hair, please consult your gynec, because there are some problems which can be corrected in time. Don't wait till the age of 20 for that. Heavy periods, painful periods, consult the gynec. Gynecs are there and they'll tell you the correct advice. Painful periods मतलब से नहीं, please कुछ भी use मत करना tablets, because उसकी आदत पड़ जाती. Why आदत? If she's got a painful period which is incapacitating her, she can take a tablet, no problem. Let her have a good quality of life. And mind you, ये मंदिर नहीं जाना, पूजा नहीं करना, is all. Who has started these laws? Men. Those pujaris over the years. So how can a woman be impure if she's having a period? No. It's an absolutely physiological process. The menstrual blood that comes out doesn't make you impure. It is a normal. Only thing you have to tell your girls, clean. Have a bath twice a day. Clean yourself. If you're using a pad, pad disposal is important. If you're using a menstrual cup, teach them how to use it. But don't, please don't tell the girls that. Older people in the house, try to convince them. You have to change your mindset. I understand if you're traveling and somebody has got periods, they're worried about how to keep themselves clean. So yeah, there you can postpone. But आज माझ्याकडे ना गणपतीचा something is there, puja. So I can't sit for the puja. I said, who said? नाही माझी सासू म्हणते. Who told the sasu? नाही त्या पुजारीने सांगितलं. Who told the pujari? No answers. So let's change. Change. Please change. Whether you are a Hindu, Christian, Muslim, all women follow this rule. नहीं हम ना church नहीं, we cannot go. Parsi, same thing. We can't go to a Gary. We are propagating wrong ideas. Let's change. Intermenstrual bleeding, that also should be addressed. And sometimes girls, they don't get development of breasts at all. They're worried. Speak to your doctor. They'll be able to help you. The girls get a negative body image if they remain short. They grow too tall. It's embarrassing. Particularly, आजू बाजू में नहीं और मेरे को हो रहा है. So calm down your girl. But there are enough specialist doctors, pediatric endocrinologists and gynecologists working together to help the girl feel better. So ये भूलना नहीं. और कभी-कभी पेट में बहुत दर्द हो रहा है मम्मा. नहीं कुछ नहीं है ना, कुछ खाया होगा इसलिए. No, but don't ignore it. Apart from worm infestation, she may be actually having a genuine problem. Please consult a doctor. And if there are any growth issues, if the child is worried, address that and please take the girl to the concerned doctor. So these are, I'm sure all of you all know, this is the female pelvis, and this is what we call as the uterus or garbhashay. Uterus ka mouth is cervix. Then you have the fallopian tubes on the sides, and the ovaries are on the side. Ovaries are the ones which give us all the hormones, and this is the general system. I'm going to discuss two particular issues. One is polycystic ovaries because it's very, 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 very common. Polycystic ovaries is a hormonal problem. It happens, why? Nobody knows. But there is a hormonal imbalance because the male hormones go slightly high up. Probably the insulin which is supposed to reach where it is supposed to reach does not reach there. So there is a problem, there is a hormonal imbalance. Male hormones rise and they give rise to all the problems. So PCO probably is a part of a metabolic problem that in future can lead to diabetes. You can have high blood pressure, you can have, this may not occur in the young age, it may occur later on. High blood pressure, high cholesterol, diabetes in pregnancy. Some girls can complain of hair on the face, lot of acne, skin issues, and sometimes they say I'm putting on weight at the midriff, and typical ऐसा होने लगता है. So you have to address, you have to find out what the cause is. Negative body image can give depression to girls, and that can cause a lot of stress. If you're not looking good, the girls को लगता है I'm not looking good. So please address these issues. Hello. So we started off before you came. So these signs are there. So the way forward is counseling. Tell your daughter you're fine. We'll take you to a doctor and we'll sort out the problem. Now PCO दो types of girls में हो सकता है. बहुत मोटे, बहुत पतले. Commoner one is the बहुत मोटे. So there you tell them about weight reduction, about exercise, dietary changes, because majority of them are binging. मैं कुछ नहीं खाती हूँ. Only when I feel hungry now I have 3 burgers. वो नहीं चलता. No, I have only Coke and wafers. I don't eat at all. That's not exactly the recommended diet. The lean PCOS girls, they have the same symptoms as PCOS, only thing they're patla. They have a different kind of hormonal imbalance. They also need to be treated, they need to be counseled more, and they need to be given low dose hormones to get regular cycles. So when we are looking at all these girls, we find out what is their principal problem. Irregular cycles, acne, lot of hair on the face, lot of hair on the hands. So we have to assess and then decide what is the treatment. So it may be low dose hormones, it may be weight reduction, sometimes we may add insulin sensitizers. So depending on whatever the problem is, we decide accordingly. And today, as per the POCSO Act, anyone who's under 18, and इसमें 17 साल में लड़की की शादी हो जाती है. Lot of Marwadi communities, lot of Muslim communities, and then the doctors face a problem because when those girls come pregnant, it has to be reported to the police. So we are trying to change, but till that time, we have to say that, girls, please stay away. Have normal relationships, but not, intimacy, because that can lead to an unwanted pregnancy, that can lead to lots of problems. So tell these girls have to be told contraception is a must. Now what about safety? How safe are our girls? We say Mumbai is the safest in the entire India. UP once upon a time was very, very unsafe, but thanks to changes made by that government, much better. What about Bihar? What about Bengal? Are the girls as safe? We hear of incidents now and then, every now and then. So something has to be done. We have to educate our young boys, because ultimately these are the guys who create a problem. Teach them, educate them to respect women, and most important is, you don't want these kind of things to happen. After that Nirbhaya episode, there are still being gang rapes. You don't want this to happen to anybody, anywhere in the world. So prevention by educating your girls. First is, if you're going out in the dark, go out in groups. Don't take, if your mother says don't use this particular road, maybe she's telling you a good reason. So educate the girls, Second is, when the girls go out for parties, never accept drinks from unknown people, because they can mix, they can put drugs, they can misuse that and cause a rape. So educate the girl. The girls must know about it. No, she's young, I can't tell her. Of course you have to tell them. They must know. Don't accept anything from any strangers. Handkerchiefs, perfumes, nothing. No, absolute no. So whenever we start training our girls, teach them self defense. मैं तो बोलती हूँ सब schools में कराटे होने होना चाहिए. Self defense, we've been doing that through our organizations. And gender sensitization. Once men respect women is superior to me. My mother is superior to me because she's given birth to me. My neighbor is also superior because she's a lady. That girl is also superior because she's a woman. That is what, if we respect Durga Ma, we have to respect all women. And this is what we have to tell our girls and boys. And of course, young small boys also are at a problem because people can do lots of things to them. But right now, since I'm talking about girls, I'm just saying that self-defense is very, very important. Of course, if a situation occurs, many of the parents, they feel, "Chai, kya bataएं, किसको बताएं?" No, please report to the police. The procedures are now much more streamlined, and we have continuously been appealing to the government. जो कोई भी molesters हैं, जो कोई भी rapists हैं, उनको कड़ी से कड़ी सजा दो. Let them be punished for whatever they have done. You can't say 3 साल, 4 साल, वही चालू है. Nirbhaya's mother, we met her in Lucknow, and she said, मैं पूरी 15-20 हजार लेडीज को लेके सुप्रीम कोर्ट पहुंच गई थी. Those rapists must be hanged. वो young है पर उसने उस लड़के को निर्दयता से मारा है, and you call him young? No, they have to be punished. All 4 of them. But कितना साल लगा उसको? How many years? 7 years. And look at that mother and father, what pains they must have gone through. What pains that this boy's parents would have gone through. But we must stop this heinous crime, and the only way we can do is prevention. If it occurs, ये नहीं कह रही उसका गड़बड़ हुआ है तो ना, she must be bad. No, the girl is not bad. It is a society जो bad करती है उसको. So that rehab program is very, very necessary. And of course, these are the youth melas which we have done through our Mumbai society, through Foxy, to sensitize young boys and girls about staying healthy, know your body, eat well. Safety is most important. Avoid porn. ये porn वाले जो मैं तो बोलूँ ban ही कर देना चाहिए. The kids get such wrong ideas from there, and there are the little older kids who influence them. Boys particularly ना बहुत ज़्यादा peer group pressure उनके आजू-बाजू वालों का लोगों का रहता है. So these were the youth melas which we did, and of course I must tell all of you that today boys and girls must be given this particular vaccine, which is now included in pediatricians as well as the gynecologists armamentarium. The prevention, the HPV vaccine for prevention of cervical cancer. Then why are we giving it to the boys? Because it is only through sex that the HPV virus is transmitted. It can lead to anal cancers, anorectal cancers, laryngeal cancers. So therefore, ये prevention मतलब आप vaccine दे दो, but after that everything has to be still safe. A woman has to still do a pap smears once every 3 years. So if under 14 दिया, तो only 2 are required, 0 months and 6 months. If it is over 14, they have to take the standard 3 doses, 0, 2 and 6. Alright, so this is something. And we do have youth-friendly clinics at Surya where we talk about all the basic things, including dental problems, nutrition, health talks, counseling for substance abuse. ये सब चीजें रहती है. Prevention of obesity, how to stay fit. Now, the question comes to an adult. When does a lady actually go to a gynaec? Some have never visited a gynaec, which is fine. But some will go for preconception counseling, which is really good. मैं तो बोलती हूँ शादी में हम गिफ्ट देते ना, give one envelope and tell her, I've paid for your preconception counseling. Go and meet the gynaec so that you take adequate contraception and you don't get pregnant when you don't want to. Many of these girls say, nahi, hum na, we don't want a pregnancy the first year, we have to get adjusted, we are doing working, blah, 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 whatever. But then plan. वो छुट्टी जाने के लिए तुम plan करते हो. You don't plan your own family and then they come for a termination. Yeah, India is a liberal country, we have liberal laws for termination, but plan, na? Don't just do everything unplanned. So the preconception premarital counseling, sometimes they're not getting pregnant, so they come, or they come for antenatal checkups के लिए. Most of the women will come because बच्चा अच्छा चाहिए issue, and delivery, lactation problems, and of course there are other issues which can occur for the the reproductive problems. They come in for that. Sometimes for termination of pregnancy. And the simplest problem is irregular cycles. white discharge. This is a common problem. Urinary problems. I just want to tell everybody, drink lots of water. Using public toilet does not give you urine infection. It's a myth. Me not that public toilet mein gele म्हणून मला infection. No, we are not sleeping on the toilets. But by postponing the urge of going, the urine gets concentrated and it invites the organisms. The E. coli grows and grows, and E. coli is one organism which flourishes in the urine. And then women start getting repeated UTIs, pyelonephritis, that is a kidney infection, and continues. So खत्म ही नहीं होता. खत्म नहीं हुआ because आपने पहले ही रोक तो. So as a child, if you're or an older sister, please train your children for bowel habits, for drinking lots of water, for using the loo when required. Do not postpone the urge. And of course, typical women, all of them will have backaches. Or if at a little older age, then uterus removals. So when you are having premenstrual problems, these are the common things, where they have already talked about them. But don't ignore them. The commonest thing which is ignored is pain in the abdomen. और फिर वो chronic बन जाता है. There's a lady whom I know, she says, Doctor, my life is miserable. I'm just working. But continuously I have pain. But then why don't you show it? No, मैंने इसको देखा, उसको देखा. No, but don't do that. Stick to a multidisciplinary group of doctors. It will take time to heal, and no doctor has got a miracle wand. Jadoo ka tona and it becomes okay. No, it takes time. Give yourself that time. So quickly about PMS. Premenstrual syndrome, majority will get. But some will have mild. 2 days before the periods, 5 days before the periods, you start feeling bloated. Thoda sa irritability hota hai. But when it blows out of proportion, when you start throwing things, when you start snapping at people, when you feel you actually get a hot flush pre-periods, and the day you get your periods, I am relieved. That is a severe PMS. So that can get aggravated by anxiety, lack of sleep, arguments, too much of coffee, too much of... So this समय क्या करते हैं? Half an hour, 45 minutes, 1 hour, mobile. Sometimes I also do it, but I don't want it to become a habit. Once in a day, everything is okay. Continuously glued to the TV, irritability होता है. Continuously laptop को जब देखते हैं, keep a small little plant on your tables so that 1 hour you worked on the laptop, have a glass of water, do a nice eyeball rolling movement, look at a plant and then start working again. It reduces the stress on your system. हम लोग exercise नहीं करते, problem ये है. बैठे बैठे भी हम पैर चला सकते हैं, हाथ चला सकते हैं. All of you lift up your hands. All of you, right hand up. Great. Down again. So बैठे बैठे भी we can do a lot of things. Because any kind of exercise, even smiling, it sends endorphins to the brain. Wake up, get up. Okay. So with PMS, apart from reducing the anxiety, sleeping habits, menstrual cycle problems, we do sometimes give low dose hormones, but before that we tell them to take painkillers for the period, find out what the cause is. Sometimes they say, oh my God, my weight is up by 2 kilos, and post periods सब weight normal हो जाता है. Typical PMS problems. So there are these problems. So how can you change? As I've already said, positive attitude कि हाँ मैं change करूँगी. Exercise, eating in time. कुछ लड़कियों को सिर्फ bread खाना अच्छा लगता है, चपाती, भाकरी कुछ अच्छा ही नहीं लगता. Stop doing that. It's all maida you're eating all the time. So change your eating habits. Have lots of fresh fruit, fresh vegetables. Sleep well. Evening primrose oil is there. You can try that. And बहुत तकलीफ हुई तो we do give low dose hormones. Now the other problem is white discharge. Some amount of discharges, mucoid discharge is normal, physiological. Pre-periods, post-periods, during pregnancy, during perimenopause. Mucoid discharge is normal. It's a normal lubrication. The mucus that is secreted by the glands is sitting in the vagina. Now the vagina has got bacteria which are friendly bacteria. हंसी खुशी से वो जी रहे हैं. But जिस दिन आपकी immunity कम हो गई, either because of lack of sleep, diabetes, or your immunity is gone down for whatever reasons, somebody is on oral contraceptives for a prolonged time, somebody is on chemotherapy, somebody has got a prolonged illness which is not getting better, they can be predisposed to fungal infection because pH of the vagina changes. So that is something which you have to watch. If there is a problem, speak to the doctor. Simple treatments are the antifungal treatments, local vaginal pessaries, and repetitive follow-up. The doctor will try to find out what is the triggering factor. Some people, while they are traveling, I tell them, well, when you have an infection, first of all, don't wear tight clothes. Allow your body to breathe. Take a bath twice. Clean yourself nicely, particularly during period time. That has to be maintained. But if there is an infection which is smelly and itchy, it could be something else. It could be trichomoniasis. So let the doctor take the decisions. Today, we are very, very worried about a condition called herpes. Because herpes, agar kisi ko ho gaya, it comes after sexual transmission. But if it comes in, it's very painful. There's a discharge. But the urinary problems can soar up and it's viral problem. So you have antiviral treatment, but it can be repetitive. So we tell people, kisi ko bhi takleef hai to please don't sit at home. Treat yourself and treat your partner. Remember, any kind of a discharge, particularly if the women are married, the husbands need to be treated too. So here again, we believe in gender equality. Why? Because through sex, it can come back and forth. And remember, the treatments are good. 8 out of 10 patients are helped. The 2 patients may be having really weak immunity. Then we give them probiotics. We tell them to improve their lifestyles. Khana pina, there is a lady whom I know, to keep her figure thin, she eats itna sa like a sparrow 2 times a day. She said, no, but I have to dance. She's a classical dancer. But तुम खाओगे नहीं तो immunity कैसे आएगी? Multivitamins सिर्फ लेने से नहीं आएगी. You eat well and then you take the multivitamins, they work well. समझ गए? So this is something which we should be worried about. Now, I think everybody would be knowing about fertilization, so I won't be talking about that. But just to talk in a nutshell, once the egg is getting ready inside the ovary, the chosen egg, it is releasing hormones which increases the lining of the uterus. Once the egg is about 18 to 20 millimeters, it comes out of the ovary, is picked up by the tube, travels through the tube. Nice, Bharatanatyam movements are there in the tube. And then it goes inside the uterus and comes out. That is ovulation. But ovulation itna patla rehta hai ki we can't see it. But you know that ovulation has occurred because 2 weeks later the woman gets a period. So what is the period? The lining which collects inside the uterus, that gets shed off. So यहाँ कहाँ अगर balance upset हो गया, so you get irregular cycles, you get 1001 problems. But if now there is a couple who comes to me and say, doctor, we are looking for we want to get pregnant, but then you realize that they are not completely aware of the physiology of ovulation at all. So an egg is alive only for 24 hours, a sperm is alive for 5 days. So when the egg is released mid-cycle, if the couple has relations, intercourse at that time, that's the time they get pregnant. Any other time they won't get pregnant. But for contraception, we say don't rely just on this because ovulation can be irregular. So this is what the message which I want to give through this. During pregnancy, of course, as soon as possible, as soon as a woman knows she's pregnant, she must contact the doctor. But if she goes before, then the doctors will advise her to take folic acid. Folic acid is very good for the baby's brain. Improve your diet, have multivitamins, have micronutrients, enrich your diet. And as we discussed in the first session itself, nutrition, अच्छा रखो, तो once the soil is good, the fertilized egg will implant nicely and the baby will grow, the ankur will grow. So once that pregnancy is confirmed, please visit your gynecologist and decide where you want to deliver during the course of your visits. Risk assessment is done and please do scans. Sonographies do not harm the baby. We don't want to do unnecessary sonographies, but sonographies is not X-rays. So most of the women will say, "मेरे ज़माने में नहीं था, मेरी daughter को क्यों करवा रहे हो आप?" But this is ultrasound. It is available now. 50 years back we didn't have. In 40 years back we didn't have ultrasound. In the last 10 years we have more access to ultrasound. We know a lot more. That's why we can diagnose much more better. So please discuss with your doctor. Sometimes the doctors will say there is diabetes, there is hypertension, बड़े center पे जाना चाहिए. Decide that, ask questions to the doctor and discuss about contraception in the pregnancy itself. Because post delivery, what do you want to do? You must plan. एक चाहिए, दो चाहिए. Whatever you decide. The earlier you have a kid, you can keep a bigger gap. At an older age, today most of the girls are married by 25, 26. They don't want to have a kid by 30, and by 35, they've decided to have the second kid, right? So, सबसे बड़ा question I wanted to address. People say, "Hey, Caesar rate बढ़ गया, doctors पैसा कमाने के लिए Caesar करते हैं." I want to just address that particular issue. The Caesar rate has gone up. One is because patients are so scared. थोड़ा सा भी पेन सहन करने के लिए they're not ready and they demand first visit to the doctor. Doctor, I only will do a Caesar. I'm telling you now only. I said, अरे अभी तो urine pregnancy test positive है, wait. So that is an anxiety. Older mothers now, because now 35, 36, 38 is average age for women. Diabetes, blood pressure, फिर जिनको pregnancy नहीं रहता वो IVF के लिए जाते हैं, फिर twins, triplets. Then people are very scared. Doctor, चिंता मत लगाओ डिलीवरी में. Means forceps नहीं use करो, vacuum नहीं. No, आप सीजर कर दो. So anxiety level. Everybody wants a perfect baby, but let the doctor try at least. So from the beginning itself इतना वो preset. And then the mother said, मेरे sister को सीजर हुआ, मेरे को सीजर हुआ, अभी मेरे डॉक्टर का भी हेरिडिटरी सीजर ही होगा. What is hereditary about a Caesar? Okay, you are short stature, that I can understand. नहीं उसका Caesar. I've had a patient, नहीं उसका Caesar ही होगा. She filled it in the daughter's mind that the daughter said, "मैम अभी मैं क्या करूँ?" I said, "Keep your mother away, keep your mother-in-law away, because mother-in-law को Caesar हुआ, mother को Caesar हुआ. You want to give a trial?" Then finally, when she thought over 2 days, she said, "Okay, I'll do it." But then both the ladies scared her so much. She said, "Doctor, जाने दो, करी दो Caesar." Who's blamed? Doctor ने Caesar बोला. Doctors are not always telling Caesars, and of course, doctors are worried about fear of litigation, because if any छोटा सा भी problem हुआ, they will say, हाँ, तुम्हाला कळलं नाही, तुम्ही MD आहात ना? The patients are quick to fire them. So we have to also realize, and another thing is, because of sonography, because of electronic fetal monitoring, we can pick up. And today's day and age, you want a baby to come out crying. You don't want a baby, you don't want the baby. Why you want that baby to cry? Because the first cry takes out all the fluid from the lungs, and we are all relieved. So nobody wants to deliver a sick baby. Of course, there are times आजकल prematurity rate इतना ज़्यादा हो गया है, infections के कारण, छोटा uterus, I mean, there are lots of issues. So we then have to say, like at Surya, we have that facility for smaller babies. But wherever there is a problem for prematurity, we tell them come to a bigger center, then we can take care. But don't just blame the doctors कि वो सिर्फ Caesar ही करते हैं. Ask, and you as a patient have a right to ask questions. Okay? Now periods can be heavy, can be light, can be irregular, can be absolutely regular. Then one patient comes and says, "Doctor, मेरा ना period हमेशा regular रहता है." मेरे को कभी छुट्टी नहीं ले पाती मैं ऑफिस से. So I said, "You mean to say your colleagues take छुट्टी?" नहीं उनको छुट्टी ना बहुत ज़्यादा भी नहीं होता. I said, "No, that is not right. You should consider yourself lucky if you get your period in time." And of course, the perimenopausal phase 40 के बाद में शुरू ही हो जाता है. Irregular cycles, mood swings, and hormonal imbalances से period affect होता है. Stress, too much of traveling, too much of office work, no break at all, no proper sleep. Fibroids. I'll talk to you about fibroids just in the next 2 slides. Endometriosis. I want to tell you about this condition now, which is slowly on the rise. As the periods come out, some amount of period blood sits in the uterus walls. Some goes through the tubes and falls in the uterus. There are many theories why it happens. Some women have got reduced immunity, जिसके कारण वो blood वो reject नहीं कर पाते. So every time she menstruates, तो छोटे छोटे spots में से भी bleeding होता है और pain होता है. पीछे जो जाके बैठता है उसमें से भी bleeding होता है. अभी imagine uterus के behind blood है, blood is sticky, so it stick to the other ovaries, stick to the bowel, stick to this, and there is a condition called endometriosis. very painful condition. So either there may be severe pain or there may be no pain, but the woman has difficulty in conceiving. Then she'll start getting heavy and intercourse is painful. So this condition is on the rise. Please, anybody has severe period problems, they must consult the doctor. And sometimes, pelvic infections, fortunately, infections is not on the rise. Means pelvic infections as we used to see when I was students, but we have infections like herpes, chlamydia. These are on the rise. So these should be prevented because eventually they will lead to pelvic infection. Pelvic infection matlab uterus swelling, tube swelling, pain, constant pain. The woman is fed up of her life. So that is something which we must know. Prolapse, the uterus slips down. Doesn't happen to everybody, but those who had 2 or more vaginal deliveries and who have not done any exercises and their collagen content is very low, they can have a prolapse. Of course, stress is one of the main problems that can affect everything in the body. So when they come to us, we ask the detailed history, we check the menstrual cycle, we ask for sonography, sometimes an MRI, then you take your diagnosis and then you decide what treatment to give. But majority of the patients का क्या है ना, 2 महीना treatment लिया, वो doctor कोई सही नहीं, let me change the doctor, and the other doctor starts investigating all over again. Then उससे नहीं होता, so in a span of 2 years they visit 6 doctors. So ऐसा नहीं करना चाहिए. You should be able to have confidence in your doctor, build up a good rapport, and discuss your problem. It's never a 2-minute consult. I spend at least 20 to 25 minutes per patient. Then you know something more about the patient. Okay? And wherever surgical treatment is required, we have to give it. The treatment will of course depend upon what the cause is, and some treatments take time. These are fibroids. Fibroids are basically tumors of the muscle of the uterus. But fibroids, tumors shabd hai, but it is not cancer. They can turn sarcomatous, but not common. And fibroids are very, very common. Look at the number of places. They're in the uterus, they're outside the uterus, they're behind the uterus, they're over the uterus. Sometimes they may not cause any problems. Sometimes they may cause any problem. अंदर अगर है तो period heavy हो सकता है, period बीच में bleeding हो सकता है. So fibroids अगर होंगे तो what should you do? Please approach the doctor. Sometimes there can be urinary problems. Sometimes the woman can say, I'm getting big. And she had such a large fibroid. She said, मेरे को लगा मैं मोटी हो रही हूँ. But actually it was a big large fibroid sitting. She already finished her childbearing. So she removed her uterus. She was already 45. So various treatment options. Always we start with medical management and then go on to surgical. But even in medical management, different types of treatments are there. Hormonal, we have got loops which release hormones, and there are different endoscopic techniques by which we can do conservative surgery and keep the uterus. Today, under 40, if you have to remove the uterus, you have to inform the governments because too much of abuse has been done. गाँव में बताते हैं आपको ना बच्चेदानी के मुंह पे छाला हो गया, ये कैंसर हो सकता है, आप थैली निकाल दो. 29-year-old, 30-year-old, this has happened in certain parts of Mumbai also. So you as a woman or whoever the patient should ask a question, थैली निकालना जरूरी है, क्या problem है? Always ask. You have the right to ask. And sometimes fibroid निकल सकते हैं. If a young woman is there, we say take out the fibroids and try for pregnancy. But if she's not young, she's older, then you can also give her the options of removal of the uterus, and it can be done the traditional way, ऊपर से, नीचे से, laparoscopically. There are newer techniques also available. But remember that a woman, as she's traversing her journey, having all her, she may not have any problem, but she may have problems also. She's multitasking, looking at the house, looking at the job, looking at the kid, looking at her children, and then she tends to ignore herself. So please don't ignore that. Stress will cause wear and tear. So please, that stress can aggravate, even precancerous conditions can get aggravated. So all the lifestyle induced stresses, we must try to be, try to change that, try to address that. Sometimes it may be depression. Sometimes the condition at home is very, very bad. Mother-in-law se bilkul padta nahi. Try to find a solution, because if you don't, you will become an emotional wreck, there can be behavioral issues. But if there's anything that affects, today there are excellent counselors, psychiatrist के पास जाना कोई बुरी बात नहीं है. If there is a need, please go. Anybody can be depressed in life. If the depression is related to someone's death, it you come out of it fast. But if there is an ongoing depression, please address that immediately. So what are the modifications in life that would help? You know the Shah Rukh Khan style. Everybody knows that style. Kaisa hai style? Put the hands. So that style is okay. I'm surrendering myself to nature. Make me okay. Drink lots of water, eat healthy, empty your bladder whenever you feel full. Don't postpone, sleep well, meditation, walking, exercise. Any form of exercise will help to reduce stress. Unhealthy gossip. कितना हमको वो सब कौन थी वो Jitendra's daughter Ekta Kapoor with all those serials, the bhabhi talking about the mother-in-law talking about the sister, what not. It doesn't help us. Those soaps don't help us at all. Forgive and discuss. If you have a problem with your boss, if you have a problem with your colleagues, discuss it. Hey, and then that goes on and on and on. Discuss with her. Listen, I didn't like you. You said I was fat. No, I don't like that comment. Please don't do it. You can talk to her instead of letting that problem go on. And please keep your savings. Learn how to invest wisely. Don't give all the money to your kids. Don't give all the money to your husband. Have your account separate. You know, this is something Poonam I always tell everybody. चाहे कि आप joint family में हो कुछ भी, आपका account आपको मालूम होना चाहिए. Only my husband can operate. No, you should also know how to operate your account. Today a patient came to me for some medical problem. I said, you can go and ask in the billing how much are the charges. Saying, no. My husband will do it because he can do it better. I said, no, you can do it well. You are educated, you are working. Go up, ask him. No, madam, he will never be satisfied. He'll ask me to go 10 times. Usko hi karne do. See, women give up so easily. Why can't you manage? If we have, who is our finance minister? So she can manage that for the country. You can't manage that for the house. Of course you can. Don't underestimate yourself. You are empowered. Take help. So learn to save, and remember your children also have a different idea, different opinion. The bosses should also know that somebody who's working with them may have a better idea. Sometimes I ask my juniors, what do you think? You think what I'm doing is right? She said, oh madam, what are you asking me? I said, तेरे को क्या लगता है? Then she say, ma'am, मेरे को लगता है ना कि ऐसे ऐसे करना. I said, good, thank you very much. Because then you learn. You know, it's not just, I mean, I love learning about newer things about the mobile from the junior people, about the Instagram, about it's learning is a constant process. So don't be totally dependent on those gizmos, but you must know a little bit about them. And again, all women don't depend totally on my children. मेरा बच्चा जब भी लंदन जाएगा तो मेरे को लंदन क्यों? मैं खुद नहीं लंदन जा सकती. So you know, if your son takes you, excellent. If your daughter-in-law is good with you, excellent. But you be empowered in such a way that उसने अगर नहीं पूछा तो आपको बुरा नहीं लगना चाहिए. And get a hobby. It could be singing, dancing, playing music. कुछ नहीं तो plantation, cooking recipes, anything. Or I have a particular lady whom I know, 5 of them, 5 friends, all of them have retired. They go for holidays once every 6 months, so twice in a year. They plan their own holidays. The husbands के साथ कभी जाते हैं, but कभी these ladies, they say it's such a refreshing group that we do. And remind you, you're not a feminist or you're not an activist, but you want to just make sure that I'm not lallu. I'm also smart. This is what you need to tell yourself. And not lalu, by the way. When I say lallu, it means I'm talking about foolish. Yeah. So get involved in social work. Also learn to help somebody. Somebody in need. It could be an older person. You know, you're a building make lady, poor lady hai. She's not having access to going to, the every day, or to the temple. Take her once in a way, or once in a way take her out. Buy something for her. There you meet so many people. Sometimes there are family members who are not very affording. Children, little children, उनको चाहिए होता है खाना. Somewhere, some kind of a social work you do, and जो आपको सबसे ज्यादा करना था. Now I'm going to ask, start from you. What do you want to do the most apart from your job? Your desire in life. Quick, fast. Like cooking. So you must learn to cook. What about yourself? Apart from your work, like to read. So you must read. What about you?
Travel.
Travel. So you must travel as much as you can. Poonam? Fantastic. So practice your dancing. So everybody must have one like apart from the work. Of course, job के प्रति निष्ठा रखो तो ही you can excel. If you love what you do, you can excel in that. But apart from that, you must also give time to de-stress and don't forget exercise. So now is a time for 40 pluses. They're all transiting from the perimenopausal years to menopause and then to post-menopause. So you see this, today women are living, average age of women 80. So most of the women are living 1/3 of their lives in the post-menopausal period. My mother lived 90. I have so many friends, mothers who are 89, 86, 88, and they're good. They're good, strong up there because they were working all through. Till 85, my mother used to do the full cooking of the house, and I only said, no, don't. Please, there is somebody there to cook. But she says, no, if I cook, मेरा दिमाग अच्छा रहता है. She used to read the newspaper and she used to tell me about the newspaper because मेरे को चश्मा लगता था. She didn't require specs. So what I'm trying to tell you is, we all are going to go up to that age. So let's be healthy. अब भी हम strong रहेंगे. And सबसे ज़्यादा क्या लगता है strong रहने के लिए? सबसे ज़्यादा क्या लगता है? Willpower, motivation, then everything comes. So motivate yourself and remember this ladder. We are all going to reach up there sometime. And we have to understand, menopause is cessation of menses. Rajo nivrutti, the ovaries stop functioning. But perimenopause में ऊपर नीचे जाने के कारण hot flushes, night sweats, irritability, vaginal dryness, hair fall, backaches, ये सब होता रहता है. Majority of the women will have minor symptoms. But there are those 15% जिनको बहुत severe होता है. Please, these women must see a gynec. And I always ask one important question is, short-term problems there, but have you thought of the long-term problems? They can be cardiovascular problems. We don't know what causes Alzheimer's, but what they have said is the sure shot way to keep dementia away is not to get nervous, not to get anxious. एक नई चीज हर हफ्ते में सीखो. It could be a new recipe, it could be new something on the phone, it could be new hairstyle, it could be how to stitch, whatever. But एक नहीं, keep that enthusiasm of a child. अरे अभी मैं बोर हो गई. No, that should not be there. Keep up that enthusiasm. And if you find a friend has a problem, she's getting depressed, take her to the psychiatrist, counsel her. And you know, women tend to think कि सिर्फ men को heart attacks आता है. Till 48-50, we are all protected because of estrogen. But after that, as susceptible, मोटापा बढ़ जाता है. Polycystic ovaries जिनको है, they are more susceptible because diabetes, hypertension, atherosclerosis, high cholesterol, all these are make them susceptible. So very important to remember that. And osteoporosis, the bones get weak and the tendency to fall. Of course, this happens more 60 pluses. But if you have not built up your bone reserve at 25, 25 is the peak bone mass, is the highest. So get sunlight, take your vitamin 3, build strong bones, do exercises. तो ही आपका osteoporosis दूर रहेगा. Of course, unfortunately, जिसको asthma है, those have been on steroids, उनको osteoporosis जल्दी हो जाता है. There are treatments available for that because this is what it contributes to the fall. Thanks to the roads, ना? Roads in India, Mumbai are bad. So काफी बार हम shoes पहन के चलते हैं. The younger girls इतना ऊंचा shoes पहन के चलते हैं. But if you have a fall, a younger girl can get up and walk. If I fall, I'll end up getting a fracture because my bones are not as strong as a younger person. My muscles are not as strong. So that is why if I'm exercising, my bones are stronger, my muscles are able to balance, and chakkar aana is a common problem in older people. So why do they get chakkar? Because they've not looked after their health. Look, ear ka problem hai, baby problem hai, address it. Somebody has got baby for 8 years. कुछ ट्रीटमेंट ही नहीं लिया, शुगर सा हाई, नहीं मैं ब्लड टेस्ट करूंगी ना तो डायबिटीज निकला तो, ऐसे डायबिटीज निकला तो ट्रीटमेंट होगा ना, नहीं 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 मैं तो नहीं करने वाली. She did 3 years she didn't do it and she was diabetic. So we have to, older people in the house, lights लगा के रखिए, marble floor में put Turkish towels so that they can wipe up the water. ये जो वायरें चलती है ना सब जगह, you can get entangled in that and fall. So be very very careful, and there should be good seats everywhere, ergonomically friendly seats. So how can you prevent these problems? Hema Malini I've seen recently, Rekha I've seen recently, they're all in there. Hema Malini is 75, Rekha is 72, but they look good. They may have had plastic surgery, but look at the way they dance. Vaijayantimala at 90 did a Bharatanatyam performance in Ayodhya. I just wonder 90 में मैं कहाँ कैसे कर पाऊँगी कुछ भी. Poonam, that's a challenge for you. So women, today at 40 we must say 40 is the new 30. So now we don't even say 40. Now 60 is also young. But all these things, good nutrition, good sunlight, positive thinking will give you a absolutely wonderful diet. Back to nutrition, balanced diet is the cornerstone. Ayurveda principles, acha diet, plenty of water, good sleep, good bowel habits, meditation. You see, meditation, prayer, you can do whatever you want. And then the sixth one is positive thinking. So the same way, we must remember that we start off with a diet. We are responsible for our own health. Women have got less muscle mass, more of, as compared to men. And we need fewer calories because we have a lesser weight. But at the same time, women must realize we must eat well. मैं उपास कर रही हूँ, मैं पोटैटो की सब्जी खाऊंगी. Tomorrow is Shivratri, so remember. But where is the protein? I'm not eating adequate amount of protein on the fast day. Otherwise, today I just have a little bit of rice and dahi. The dahi will give you calcium. Where is the protein coming from? So I need protein. When I'm eating my dal and rice, dal ज़्यादा होना चाहिए, उसमें थोड़ा सा चावल होना चाहिए. So make sure your diet is balanced. And very very important is, we are thinking of micronutrients and vitamins. Vitamins is A, B, the B group of vitamins, C, D, E. There is no F. So all the vitamins, the body doesn't make it, is from outside. Okay? There are certain biochemical reactions in the body for which you need vitamins. Then what are micronutrients? Micronutrients, apart from vitamins, even the small minerals, chota is copper, zinc, boron, selenium, manganese, whatnot, all these are required for all our body's cellular mechanism. Ekhadi ki deficiency, prolonged period mein you will end up having a problem. So therefore, body needs these micronutrients in small amounts to support, and therefore address this. They should also be provided. You can take vitamins, you can take micronutrients, but along with your food, please take this. Of course, food can also give it, but sometimes you're not eating. So much of carrot you eat, you'll get vitamin A. So much of beans you'll eat, but hum itna sa beans khate hain. So then, that's where your supplementation comes in. So this is a very beautiful slide which suggests, this is from Mayer, but I like this slide very much because it tells you exactly what calcium does, what iron does, what zinc. Iron is very important because anemia is very very prominent in India. But you need all these little, your boron, calcium, vitamin E, all these things are required in a right balance to keep your body's systems going, to keep your bones going, for keeping your mental health, and for keeping your, all the endocrine glands. They all require a small amount of minerals. And of course, added to that is a physical activity. Just one thing I'd like to tell you, when you're constantly on the move, you're working, your brain gets that information, produces more opioids, you feel more endorphins, you feel much more positive, reduced tendency to fall, more positivity, and your actions are much more quicker. Now we're coming to the last few slides. Gift yourself. Today we start this. Gift yourself a health package. You can do it around your birthday. इसमें your weight, BP, routine bloods, thyroid, vitamin D3, B12, blood sugar, lipids, sonography, pap smear once in 3 years, self breast examination once every month post periods. Right hand, check the left breast, left hand, check the right breast. With the right hand, also check the armpits and check the collarbone. Self breast examination. If you feel there is any lump or bump, report to the doctor. After 40, we start doing mammographies once every 2 years. If there's a family history of breast cancer, then you have to do it more frequently. But women require an ECG after the age of 40, so don't think only men require it. And other specialized tests depending on what is required. और ये अपने आप को ये gift दे दो. Don't wait for your kids or your husband to give it. So if you are in a menopausal situation and you have a problem, you've taken everything, you still feel there's a problem, consult your doctor. There is a menopausal hormonal therapy which can be given. The doctor will look at all the risks and decide. And remember, there is no one thing. मेरे friend को तो मेरे को भी मैं ले सकती हूँ. No, one size doesn't fit all. You find out less than 40 years, much more better. Women get their menopause sometimes at the age of 35. They've had multiple surgeries, so they have to have replacement therapy. Between 40 and 50, the benefits exceed the risk. After 60, we generally don't want to take it. But remember, if you take it, you have to do a regular follow-up. And the last slide, problems in the elderly population. We all have older people at home, arthritis, common, heart disease, cancer, cancer survivors, stroke, lung problems, and post-COVID, so many people have suffered lung problems, unintentional injuries, diabetes and its complex. Diabetes is one disease. If you eat well, exercise well, take your medicines regularly, the chances of having less problems are there. But if you don't take care of yourself and your timings, sometimes as an elderly person, बीच में से खा लेते हैं, बराबर टाइम पे नहीं खाते, you have to supervise that. And Alzheimer's disease. Alzheimer's disease is found to be more common in women as compared to men. But in women who are very thin, very anxious, in women who are very, laid back, no exercise, but we still don't know what exactly causes it. But अपने brain को acute अच्छे से रखो. And remember, any problem हुआ ना, except your illness, cancer was so what? I've got it, I'll face it. Then you can face your, why me? एक बार रोना धोना होता है, okay, but then why me नहीं? मेरे को work with the doctor to get the best possible outcome. रोना धोना, then 10 relatives are there, तू बिचारी. No, there is no बिचारी. आप समझ रहे हो मैं क्या बोल रही हूँ? Don't get over. Today I find the older generation would accept their problems better. The younger girls, जरा सा कुछ हो, my God, because they've already consulted Dr. Google, and Google has said this is dangerous, that is dangerous, this is. But you're not a doctor, and Google is unfiltered information. So please don't get overwhelmed with their problem, and that's why then the incidences of problems, mental problems are more. नहीं, my daughter ना thinks too much ना, उसको ना सब डॉक्टर का पता है, इसके लिए ना, I said गलत आप हैं, आप बच्चे को समझाइए, not to why Google and why ask 10 friends. Look after your health. आप you've fallen down, look after your health. Try to do your exercises, do your physio. So positive attitude to life is very, very important. And tips on healthy aging, I've said everything. Only one thing I'm going to add is vaccinations in particular age groups after 50, after 60. Please don't forget, if you have elderly parents, please ask your doctors. Teeth. A visit to a dentist is also important. Majority of the times the digestion problem starts with bad teeth. And smoking, कोई भी घर में कर रहा होगा तो मना कर दो उनको करने को. Use a tactic to, reduce smoking. And catch up with friends. It's fun to be with friends and visit your doctor. यार हम लोग तुम्हारे दुश्मन नहीं हैं. Build up a trust relationship. Ask questions. Discuss. Keep your files intact. I have a patient. Doctor, I'm so sorry. I forgot my file. Okay. Once, twice. Every time you forget your file. So three files, four files I'm sitting and making and writing. I said, I can't. Doctor, you don't remember. I came 3 years back. The time I period. 3 years back, sabhi period problems ही आते हैं. How can I remember you don't remember your period problem. You think I can remember it? So keep your files. Why are we so bad? ना तो ते files paper देंगे ना, उसको double it's gone. So keep your files And one advice I want to tell everybody, mobile phones का इस्तेमाल करो, but I am kind and I give my phone number. Little things they will, middle of the night, doctor, I send you a WhatsApp. Time 3 o'clock. You think 3 o'clock I'll be awake to see a WhatsApp? If it's an emergency, please call. Pregnancy, please call. But you missed your periods, so you're calling me up at 11 o'clock in the night to say you missed your periods. Whole day क्या कर रहे थे? So be kind to the doctors also. Don't just, and Dr. Google is not the authority. Supreme Court now prohibits giving any prescriptions over the phones. So they'll say, doctor, मैं ना 3 साल पहले आपके पास, आप डॉक्टर नहीं चले मेडिसिन लिखे मेरे को, मैं दुबई में रहते हूँ. I said, sorry, not allowed. So anyway, the good talk is, it's our day. This week, tomorrow, day after, the entire week, the entire year. So this is a poem which I've written, which I always, like to read, because women power. Your strength is like the mountains, strong and steady. Your eyes are like the stars, blinking but yet vibrant. Your encouraging words are like a gurgling river, forever flowing. Your mind is like the sky, expansive and absorbing. Your heart is like the ocean, vast and forgiving. You are an epitome of beauty, the most beautiful creation of God. So remember, friends, behind every strong community stands a well-nourished woman. An empowered woman means an empowered family, an empowered society. And eat well, drink plenty of fluids, exercise well, nourish to flourish. Thank you very much.
Dr. Pandit, thank you so much. It is always so enriching to listen to you. I'm sure all the women out here have benefited from the session. And we have with us our director, Uma. She is an epitome of true leadership and a woman power in action. So madam, few words from you.
I had a chance to meet her, but I didn't meet her personally at Orissa, at Amit Patti's installation.
Yeah, so good evening, and it's a pleasure to be with you all this evening. And thank you so much, Dr. Pandit. And I always have a great respect for two communities. That is, one is doctors and one is teachers. So I think that two community which need not pray to God because they are doing a great work, and the doctors are the companion of women at every stage of their life, because I know the gynecologist, she has not told you the pain, because they're anywhere, even if we have the liberty, though we are working in the corporate, we can plan our holidays, we can plan our events, but that is not the case when it comes to the doctor, especially gynecologist, because anytime they are always worried someone has delivered the baby, or in the night they will get a call, now the patient has been admitted. And I have a lot of gynecologist friends who have studied along with me until 12th, and that is a kind of life there. And in spite of that, see the calmness and the composure that they carry, something that we all have to learn, because we have a few problems and then we get panic and we get stressed out. But you see that when doctors are handling the problems, it is a question of life and death. And so it's very difficult, and at that time they have to make a decision. They cannot go to their superior and ask what to do now. They have the things on hand. They are having the patient in front of them, and then they have to take certain decisions, especially now when we see that the women today, I think that they have to change themselves a bit when it comes to their food habits, when it comes to their tolerance level. I think that as we are celebrating Women's Day and we are going ahead, I think that few of the things that we definitely have to learn from our parents, from our grandparents is that we need to have the better patience level. We need to have um, good food habits, and along with that, I think that we need to inculcate in ourselves um, the learning habits. We need to read every day. It is very important. Many times we will see that we'll spend a lot of time watching TV and watching mobile, Instagram, and all those things. But how many of you read newspaper every day? Can raise the hand? Just see the percentage of the people. How many of you read books at least every month? Some book. Yeah. Yeah. So make sure, team, that it is very important that we have to enrich ourselves with the knowledge. And we feel that we have taken our education, we got our job, so now this learning is over. That is never the case. And always, as the doctor has said, that pursuing your passion is very important because it will give you immense pleasure. And another most important thing is that keeping your me time. That is very important. It can be half an hour, it can be 15 minutes, it can be 1 hour, anything. But make sure that you have some time for yourself. That is very important. And in that your me time, make sure that you do anything which you like the most. And of course, helping someone always gives a great pleasure, and it can be very small help. You cannot say you giving your time and speaking to someone is also helping. And another most important thing I feel that the physical health and mental health both are very important. And so each one of you need a sponsor. So what is sponsor? Is someone whom you can reveal everything that you have. It can be your mother, it can be your father, it can be your brother, sister, husband, your child, anyone. But you need to have a sponsor that you are leading. That should never happen. And when you should also be the part of some community which will help you to exchange the thought. You will know that how the things are happening, especially young mothers, how to cope up with the work-life balance and how to cope up with the stress that happens. And then when you interact with those colleagues, you'll understand it. Oh my God, I am not doing that much of touring. My girlfriend, she's doing touring practically 15 to 20 days a month, and how she's coping up. So that will always help you people to do the things. And what doctor said, that ensuring that you people do your nutrition right, exercise, and mental exercises like crosswords or any kind of things which will make you happy, and then pursuing your passion and this. And I think that Women's Day is celebrated once in a year, but we have to do it every day, and we have to ensure and we have to strengthen ourselves. And we cannot say that women we need some help or something. We definitely need to be independent. As what she said, that freedom comes with a price. So it is very much necessary that if at all, I definitely need to study the situation and don't unnecessarily carry any fears in your mind. But the taking precautions is very important. If at all you are traveling in the night, in that case, make sure that you have all your set system of your own known drivers, known, and then utilizing Ola, Uber, whatever, because then Ola, Uber is there, then they, at least you have all the security in the place. If at all some Ola, Uber's driver you come to know and then you try to utilize that driver, okay, I know him, so I will utilize him when I'm traveling in the night. Don't do those such kind of things. Ensure that you are all well protected, and your family should be definitely. There are two gardens. One is a garden in the front, which is our career, our education, our this, and there's a backside garden, which is a relationship. So you need to nurture both the gardens so that you will become a successful person. And I thank doctor for the valuable insight that she has given, and I'm sure that the advices which she has given each one of you, following that, that will definitely make each one of you well woman. Thank you.
Felicitation for Dr. Suchitra Pandit.